Hello students, I am Srishti Tiwari. How are you all? I hope you all are fine. So protect yourself from coronavirus and be careful. In last class we have discussed about the BPH, that is disorder of male genitourinary system, and today we are going to discuss about the second disorder of male genitourinary system, that is or-KIE-tis. So we are going to discuss about the introduction of or-KIE-tis. Or-KIE-tis is an acute inflammatory reaction of testis. It is an acute inflammatory reaction of testis secondary to infection. Firstly, it causes infection in the testis and it leads to acute inflammatory reaction, that is known as or-KIE-tis. Most cases are associated with viral mumps, means the or-KIE-tis mainly it caused by the person who is having the viral mumps. And not only the virus is causing or-KIE-tis, but also bacteria also can be the causative agent of the or-KIE-tis. Or-KIE-tis most commonly occurs with the epididymitis. So what is epididymitis? Itis is related to infection. Itis means infection, and epididymis is the part of male reproductive system. So epididymitis is usually is a bacterial origin. It is a only bacterial origin. So here the one notable thing is there, that is the men aged between the 14 to 35 years, they are the risk of getting means or they are having the risk of getting the infection with the Neisseria, gonorrhoeae, and the person who is having the age of less than 14 years or men who is older than 35 years, they are affecting with the bacteria, that is Escherichia coli. Viral or-KIE-tis is the most common cause of mumps infection. In this picture we can understand about the anatomy of the male reproductive system. So this is the epididymis and testicle. So in the cross section of this picture we can mainly understand about the epididymis and testis. So these both two organs that are getting affected in the or-KIE-tis, that is mainly epididymis and testis. So when the infection is causing in the epididymis, means infection or inflammation is causing in the epididymis, that can leads to the infection in the testis also. So this condition is known as Epididymo-orchitis. Definition of or-KIE-tis is or-KIE-tis is a Greek word which means an inflammation of one or both testicle. In this, the both testicle may be affected by or-KIE-tis at the same time, but the symptoms can be seen only in the one testicle. As here in the picture we can see this is the testis that is affected, that is or-KIE-tis, and here we can see the normal testis and epididymis. In this picture we can say that this is infected one, epididymis as well as testis is both are infected. Next we will see the causative agent of the or-KIE-tis. First causative agent is bacteria. So there are so many bacteria that are responsible for causing or-KIE-tis. First one is Neisseria, gonorrhoeae. Second one is Escherichia coli. Third one is Chlamydia trachomatis. Fourth one is Pseudomonas aeruginosa. Fifth one is Klebsiella pneumoniae. And so these all are bacteria is causative agent of or-KIE-tis. So previously we have seen the Neisseria gonorrhoeae is mainly affecting the age those who are having the between 14 to 35 years, and Escherichia coli mainly those who are having the less than 14 or more than 35 years. Next causative agent, that is Staphylococcus and Streptococcus species, are also responsible for bacterial orchitis. As here in the picture you can see, the Staphylococcus species bacteria are spherical in shape. Bacterial orchitis often results from epididymitis, that we have already discussed. The epididymitis is usually caused by bacterial. So epididymitis is a inflammation of coiled tube, that is epididymis, at the back of the testicle that stores and carries the sperm. In this case it is called Epididymo-orchitis. So next causative agent, that is virus. So there are so many viruses those who are causing orchitis. First one is mumps, second one is Coxsackie virus, third one is infectious mononucleosis, fourth one is varicella, fifth one is ecovirus. So these all are viruses those who are responsible for causing orchitis. Next, the viral orchitis related to mumps develops anywhere from 4 to 10 days after the salivary gland swells. In this the sentence stated is when the person is having mumps. So the swelling in the salivary gland is taking place. When the swelling in the salivary gland is taking place, then after the day of swelling, after that the 4 to 10 days the person can have the signs and symptoms of orchitis, or person can develop the orchitis, that is viral orchitis, because the person is developing orchitis by the mumps. So next, that is the immunocompromised patient is also having the risk of getting orchitis. Means immunocompromised means the person who is having less immunity or decreased immunity, the person, their immune system is not that much stronger, and these all are agents, we can say these agents are mainly affecting the immunocompromised patient. So the immunocompromised patients are also having the risk of getting orchitis. Next, we will see the risk factors. So here the risk factors are mainly divided into two. So first risk factor is non-sexually transmitted orchitis. First risk factor is non-sexually transmitted orchitis. So in that, first we can see that is not being immunized against mumps. So the person who is not being immunized against the mumps, the person is having the risk of getting orchitis. And second, having recurring UTIs, means the person who is having the reoccurrence of urinary tract infections, means those person who is having the urinary tract infection again and again. Third one is being born with an abnormality in the urinary tract. The person or the children who is getting born with the abnormality or any congenital abnormality in their urinary tract, so that person is also having the risk of getting orchitis. And fourth one is having the surgery that involves in the genital or urinary tract. Here they are saying that the person who is having the surgery in their urinary or genital tract, the person is also having the risk of getting orchitis. Next risk factor we will see, that is the sexual behavior, means the person that is associated with the sexual behaviors, means the orchitis that is caused by some sexual behaviors. First one is having the history of STI, means sexually transmitted infection. The person who is having the previous history of having the sexually transmitted infection. And second one is having a partner who has an STI, means the person, anybody who is the partner, who is having the partner, those who is having the sexually transmitted infections. And third one is having unsafe sexual intercourse with the infected person. Any infected person with the STI, sexually transmitted disease, and they are intimating or maintaining sexual intercourse with each other, so these the person is having the risk of getting or-KIE-tis. Next, this is the sign and symptoms of or-KIE-tis. So of any infection, that is the fever is the most common and first sign and symptoms of any infection, that is fever. Second one is painful ejaculation. Painful ejaculation, patient used to have the pain during ejaculation. And third one is a swollen scrotum, means the person will be suffering from the or-KIE-tis, so their scrotum will be swollen, means the swelling in the scrotum will be seen in the or-KIE-tis patient. It will become, scrotum will become longer or larger in shape. Fourth one is tenderness in the scrotum. Tenderness in the scrotum is seen in this picture. And fifth one is pain in the testicles and groin is the primary symptoms of or-KIE-tis. Pain in the testicles, pain will be there due to inflammation in the testicle, and here in the groin area, a person will have the pain in their groin area. That is the primary symptoms or first symptoms of getting or-KIE-tis. Next is sign and symptoms, that is painful urination. Patient will be having the pain during urination. And next one is blood in semen. And abnormal discharge will be there through the urethra. And enlarged prostate. Enlarged prostate, as here we can see, this is the normal prostate, and here we can see that this is enlargement of prostate gland has taken place. So due to the enlargement of the prostate gland, the patient will be having the painful urination. The person will be having the pain during urination. And last sign and symptoms, that is swollen lymph node in groin, means the lymph node, those who are present in the groin area, that lymph node will get swollen and the patient will be having pain in the groin area. Next, we will see the diagnostic evaluation. So first diagnostic evaluation that we have to do, that is medical history. In medical history, the doctors used to ask the patient that the person is have had any previous symptoms of or-KIE-tis or any previous history of STIs, or that is sexually transmitted disease or not. Second one is physical examination. Physical examination, the head to toe examination will be there in the physical examination, but to find out the or-KIE-tis, the mainly physical examination, that will be digital rectal examination, means in the sign and symptoms that we have seen, the person is used to have the enlargement of prostate gland. To find out the enlargement in the prostate gland, the digital rectum examination will be performed in the physical examination. And some more findings will be there in the physical examination, that is the testicular enlargement will be seen, and the tenderness also will be seen in the during the physical examination. And erythematous scrotal skin will be seen, as in the picture you can see, this is the erythematous scrotal skin, and the edematous scrotal skin will be also there. This is the this you can see in the picture, this scrotum has been swollen or edematous. So these all are findings we will see in the physical examination the patient with or-KIE-tis. So third one is ultrasound. This is the important diagnostic evaluation. In USGA, ultrasonography or ultrasound, this imaging test in the most common used to assess the testicular pain, means this is a common procedure or commonly used procedure to assess the patient is having or-KIE-tis or not, or patient with testicular pain. So this USG will be done with the color Doppler, and it will determine the blood flow to the testicles. So it will determine the blood flow to the testicles, and if the blood flow with the color Doppler, it will show the result that can be the lower blood flow. It will show the blood flow towards testicle that can be the lower than the normal, or it can be the higher than the normal. So it will which helps the confirm in the diagnosis of or-KIE-tis. So higher blood supply to the testicle, that denotes the infection or inflammation of the testis. Next diagnostic evaluation we will see, that is urine test. Urine test should be analyzed to see anything that is abnormal or to find out any pathogen. I am repeating, urine test. In urine test, the urine should be analyzed to see that anything is normal in the urine or any pathogen that is present in the urine. Or next one is STI screening, means sexually transmitted infection screening, means some culture swab should be taken and it should be sent to the laboratory, and the causative agent of STI will be seen in the lab report. So next we will see the medical management. In the medical management, so for the if the patient is having the or-KIE-tis that are caused by bacteria, so antibacterial therapy will be given. So drug for the antibacterial or antibiotic, that is ceftriaxone. So this is the third generation cephalosporin purposely used for the Neisseria, gonorrhoeae. And second drug, that is doxycycline. It inhibits the bacterial protein synthesis, means the bacterial protein synthesis. This drug is inhibiting the bacterial protein synthesis and it inhibits the growth of the bacteria. And third one is azithromycin. It's treated the mild to moderate infection or that is caused by the chlamydia or gonorrheal infection. And next one is ciprofloxacin. So this ciprofloxacin and ofloxacin should be given to the patient who is having the age of less than 14 years or more than 35 years, because the person who had the or-KIE-tis with the causative agent of Escherichia coli or E. coli, and the ceftriaxone and doxycycline will be given to the patient who is having the age of 14 to 35 years, because these medications are helping to destroy or to inhibit the bacteria, that is gonorrhea. Next we will see the antiviral therapy, the person who have had the or-KIE-tis by the bacteria. So the drug is ibuprofen and naproxen sodium. Next, the nursing management. In the nursing management, first one is hot or cold packs for analgesia. So hot and cold application will be provided to the patient to relieve pain, and the patient should put a small pillow or towel between the legs, and for elevation of the scrotum and placement of ice on the affected testis, and place ice on affected testicle for 10 to 15 minutes 4 times a day until pain is resolved. So these all are nursing management that I will repeat, that is a hot and cold application for to relieve pain, and the patient should put a small pillow or towel between the legs to elevate scrotum and placement of ice pack on affected testis, and ice pack should be kept on the testis for 10 to 15 minutes for 4 times in a day until the pain is resolved. Next, we will see the complications of or-KIE-tis. Complications of or-KIE-tis may include scrotal abscess. Scrotal abscess is the pus collection in the scrotum. Infected tissue is filled with pus that leads to scrotal abscess. And infertility. Or-KIE-tis can causes infertility or inadequate testosterone production. Means testis is a organ that helps in the spermatogenesis. So because the spermatogenesis will not be there, because the imbalancing in the gonadism or testosterone production will be there, so it will cause the infertility. Next complication, that is testicular atrophy. Or-KIE-tis can eventually cause affected testicle to shrink. Means due to the less blood supply, it will cause testicle to shrink. So as here in the picture we can see, that is the healthy testicle, and this is the atrophy of the testicle we can see. Due to less blood supply, here the testicle is used to get shrink. Next we will see the summarization of today's class. So firstly we have seen the introduction about the or-KIE-tis, and definition we have seen, that is the infection or inflammation of the testis, and causes we have seen that can be the bacterial or viral, and risk factors that we have seen that can be the STI or that is not related with STI, and some clinical manifestations we have seen, prostate enlargement and scrotal erythematous will be there, and diagnostic evaluation we have seen history collection, physical examination and ultrasonography, and management we have seen the medical management, that is bacterial therapy. So drugs are used in the or-KIE-tis. For antibiotics, that is ceftriaxone, doxycycline, azithromycin, ofloxacin and ciprofloxacin, and antiviral therapy also we have seen in the management, and nursing management we have also seen. The nurse should apply the hot and cold application to the patient to relieve pain, and that the hot and cold application should be for 10 to 15 minutes for 4 times in a day until the pain get relief. And complications we have seen, that are this testicular atrophy, scrotal abscess and infertility. Thank you class.